Hello and welcome to the Sports Medicine Research Podcast webinar, where this week we will be exploring articles that are pushing the laboratory boundaries for analyzing running mechanics. My name is Alexandra DeJong, and I will be leading you through this podcast today. Thank you for joining. This week we'll be reviewing two articles, the first by Rinalda and colleagues in 2019, that were looking at kinematics and shock attenuation during a prolonged run on an athletic track as measured with inertial magnetic measurement units. The second article is by Zhang and colleagues in 2019, looking at if runners can maintain a newly learned gait pattern outside a laboratory environment following gait training on a treadmill. The first article we're going to take a little bit of a closer look at is looking at the prolonged outdoor running monitoring in athletes on an outdoor track. So the researchers were interested in the clinical question addressing how are loading and kinematic outcomes influenced by prolonged outdoor level running. So in this study, the authors were looking at running at a sub-fatiguing state. So just a prolonged run on an outdoor track at a submaximal level, but still doing a longer run over time to see if any of the loading and kinematic outcomes might have changed from an earlier time point in the run to a later time point in the run. The implications here are looking at potential changes that may be related to lower limb injury risk, such as tibial stress injuries, as the authors were also looking at tibial metrics across the run in these individuals to see if potentially anything might relate to tibial stress fractures or other potential issues as well. So in the central figure here, this is pulled from the article that we're examining today, and this is an example of the setup in one of the subjects. So for the methods, 10 male runners completed a sustained outdoor 20-minute run at a constant pace on an outdoor track. So they were running at a submaximal threshold, and this was controlled by another individual who was following along with the runners around the track to help them maintain a pace and run at a submaximal level. And wearable sensors were located all over the body and secured using a Lycra suit in order to obtain their main outcome measures using wearable sensors at the trunk, at the thigh, the shin, and the foot. So the main outcome measures that the authors were really interested in exploring were loading and kinematics. Specifically for loading, they were looking at peak tibial acceleration, peak sacral acceleration, and shock attenuation over the course of the run. Additionally, they were looking at hip angles, knee angles, and the vertical lower leg angle throughout the run as well. And as they were looking at the run, they were looking at straightaways at minutes 3 and 18 of the 20-minute run to see if any of these outcomes might have changed at these different time points. In terms of the findings, the authors found that while some metrics maintained fairly constant at the 3 and 18-minute time points, there were some outcomes that changed at the later time point in the run as opposed to the 3-minute time point. Specifically, peak tibial acceleration and the knee angle at initial contact significantly increased at the 18-minute time point, whereas the knee angle at mid-stance and the hip angle at mid-stance significantly decreased for these individuals at the 18-minute time point. Thus, there appears to be a bit of a stiffer landing pattern at mid-stance for these individuals over the course of a sustained run versus when they are just first starting out. And this was associated with an increase in peak tibial acceleration, which could have some insight into tibial stress fracture risk. However, they did not find any significant findings for vertical lower leg angle, peak sacral acceleration, shock attenuation, or hip angle at initial contact in these runners. So the only metrics that really changed were the knee at initial contact in mid-stance and the hip angle at mid-stance, as well as the peak tibial acceleration. This study is important because it starts to get at the injury risk versus injury consequence chicken or the egg approach. So these individuals that they were studying were all healthy individuals, healthy male runners, and they were running at a submaximal state. And yet they still found that there was increases in peak tibial acceleration and there were alterations in kinematics for these individuals as well. So this may lend a little bit of insight into potentially risky running patterns that might be associated with injury. So alterations in mechanics were associated with this increase in tibial acceleration, and the authors speculated that this is likely that more forces were imposed on the bone as opposed to being absorbed by more dynamic structures. So since the individuals were landing with a little bit more of a stiffer knee and stiffer hip position at mid-stance, potentially more of the force was going to the more static structures or the bony structures in the leg, as seen with the increases in tibial acceleration. So therefore, this is pretty similar to findings in runners with lower limb injury. These individuals tend to have higher peak tibial acceleration and differences in their kinematics during running as opposed to healthy individuals. So even though these individuals were healthy, potentially we're getting a little bit of insight into injury risk over sustained runs, even in healthy individuals. So there are several important clinical applications that can be drawn from looking at the results of this study. The first one being potentially implementing wearable sensors to monitor injury risk in runners. So we know that over the course of this run that was measured in this study, they began to see changes over time. So this really leads to monitoring athletes over time to see where the breakdown might be happening and where their changes might be occurring in order to guide kind of gait training or potentially looking at some sort of other intervention to decrease injury risk. This leads to the next point, which is that training gait in fatigue states may be warranted or potentially over a prolonged run as well. So once individuals are out and running and they begin to change their landing patterns that might be associated with more risky running behavior, perhaps that this is a good time to do some gait training interventions here to decrease the amount of stresses imposed on the lower extremity. Finally, neuromuscular education might be important to implement to reduce the bone loading. So encouraging individuals to use more of their dynamic loading structures, like the muscles of the legs and the hips, to absorb some of the forces that are going through the legs throughout running would be really important to reduce some of that loading on the bone. So future work should look into neuromuscular education of the thigh and the hip muscles to see if we can positively impact some of these risky behaviors as well. Next, we will take a look into the DeJong article where they looked at gait training indoors and seeing if there was any outdoor translation in a couple of different settings. So the clinical question that the researchers were aiming to answer were, are runners able to translate newly learned running patterns from gait training on a treadmill to outdoor running? So a lot of gait training is done indoors on a treadmill because clinicians can easily look at athletes as they are running and as they are performing their gait training interventions. However, it's unknown if this indoor gait training would fully translate to outdoor running. So this is the question that the researchers were interested in getting at. The implications are important because they were looking to reduce loading associated with lower extremity injury risk in a variety of running settings. So again, in this instance, looking at the potential of tibial stress fractures or tibial stresses during running and hoping to reduce some of that loading on the bone and seeing if we do this indoors, does it fully translate to outdoor running? So for the methods, the researchers looked at 15 higher loading runners. So they did a baseline analysis of runners with an accelerometer placed on the tibia and identified individuals that were loading more than 8 Gs at the tibia and identified those as higher risk individuals. So those that were higher loaders were looked at. And then these individuals received visual feedback for 8 sessions over 4 weeks to reduce loading during treadmill running. So there's an example of what the gait training looked like in the lower right-hand image. So the teal line on this image is showing at about 80% of the average peak shock at the tibia. So the individuals were wearing the sensors. They got an idea of how much shock was going through their legs, and then the researchers aimed to reduce their loading at the 80% of the average tibial shock at this point. So the white lines are indicative of what the peak tibial shocks would look like over the gait cycle for the individuals receiving the feedback. And the goal was to reduce the loading below that blue line. So anything that was over, the individuals would receive feedback to reduce their loading so that it maintained underneath the 80% line. The feedback was provided in a faded design, similar to Pohl and colleagues in 2008. Such that the feedback was gradually introduced over the first 4 sessions until there was a solid amount of feedback provided at about 20 minutes. And then it was gradually removed over the last 4 sessions to make sure that the individuals did not rely too heavily on the feedback and to ensure that the feedback provided would maintain over the runner's mechanics over time. The researchers performed pre- and post-assessments of tibial shock in the following scenarios. So they first looked at individuals running indoors on a treadmill during a flat course. They also introduced an incline and a decline at 10% grades during running on the treadmill. And then they also examined these running mechanics in an outdoor overground flat running scenario on concrete and an introduction of a 10% grade uphill and downhill on concrete slabs outdoors as well. So these assessments were performed before the gait training and also performed after the gait training to determine if there were any changes in the running mechanics based on the feedback given in these different running scenarios. So overall, the researchers found that some individuals did respond to the gait training feedback while 3 did not. So the researchers took a closer look at those who were responders to the feedback to see where they were able to change their mechanics and in what settings. So first, they found decreased peak tibial acceleration in level treadmill running, uphill treadmill running, and downhill treadmill running. So all treadmill-based running scenarios were positively impacted by the gait training, as the goal was to reduce peak tibial acceleration. Interestingly, they also found that peak tibial acceleration decreased during level outdoor running on the concrete over ground. However, there was no change in uphill or downhill outdoor running scenarios based on the gait training received. So there was no decreases that were significant from baseline in the peak tibial acceleration in these outdoor training scenarios. These findings are extremely important because although running biomechanics improved for indoor running and level outdoor running, gait training did not fully translate to outdoor running conditions. So uphill and downhill running outdoors did not have the same outcomes as the researchers were expecting based on the indoor gait training. So this is important because indoor gait training may not fully translate to natural running environments for injury risk reduction. As a lot of individuals engage in running outdoors on a regular basis, and this is a more natural running setting, it's important to note that this did not fully translate and that perhaps our gait training interventions should be targeted more outdoors. So for the clinical implications, indoor gait training may be a starting point for patient education. So if individuals are at higher risk for a lower extremity injury, we did find that treadmill running, based on these findings, did positively impact some outcomes. And so starting with an indoor gait training session where a clinician can do more hands-on gait training with individuals in a supervised setting may be beneficial for them to begin to reduce the loading at the tibia. However, there are also implications for gait training in natural settings. So if we can begin by gait training indoors during treadmill running, this may be a good starting point, but then ultimately translating this to outdoor gait training would be really important to make sure that we are fully impacting positive outcomes for these individuals at higher risk for injury, especially in their natural running settings. So overall, there are several take-home messages from both of these articles. So lower limb loading and hip and knee kinematics may contribute to injury risk during sustained outdoor running. This is important to note because we want to try to mitigate some of these risks associated with running for prolonged periods of times and may guide some gait training outcomes. Additionally, we found that though treadmill gait training is able to decrease loading mechanics in artificial and flat running environments, these outcomes may not fully translate to outdoor running, and we should keep this in mind as clinicians when we're prescribing our gait training scenarios. Monitoring runners outdoors should be considered to help decrease injury risk, taking all of these findings into account and to positively impact our outcomes for our patients. So what can we do with the findings? Recently, I was able to do a systematic review with Jay Hurdle, looking at gait training devices in the treatment of lower extremity injuries in sports medicine, looking at current status and future prospects. So one of the categories in this systematic review was leg pain. So ERLLP stands for exercise-related lower leg pain. And then we were able to pull articles from each of these respective researchers on the right-hand side of the screen, looking at what kind of interventions they did for those with leg pain and currently suffering to positively impact their gait parameters. So if we look at this figure, starting with leg pain patients, if we begin to use accelerometers and metronomes to control the amount of loading and control the cadence of runners, then we may be able to decrease average and instantaneous loading and decrease tibial acceleration by looking at more of a forefoot or midfoot strike for the runners, decreasing loading, and increasing cadence techniques. So overall, taking into account the findings that we found today and pulling all of the data from these respective articles. These may be really beneficial gait training techniques to use, especially in field and in the setting. In the field setting. So accelerometers are able to translate from the gait lab to the outdoor setting to positively increase or positively impact these findings so that we're decreasing the risk of injury or decreasing the amount of pain people might be experiencing if they are runners with leg pain. So kind of putting everything together, if we start to move more out of the lab and look at some of the deleterious adaptations in runners that are at injury risk, then potentially we can positively increase their outcomes by addressing these different issues and using more of a field-based approach to our gait training. Thank you so much for tuning in for this week's webinar, and be sure to stay posted for new upcoming webinars and other podcasts put on by the Sports Medicine Research blog. Thank you again for tuning in and hope you enjoyed the webinar.